So now it's my distinct pleasure to introduce my friend and colleague, Dr. Gurjeet Birdee. I first met Gurjeet when he was completing his T32 fellowship at our Osher Center between 2007 and 9, during which time I had the privilege of serving as an ancillary mentor for his work, which centered around the study of yoga for both pediatric populations and for people with end-stage renal disease. In the time since Gurjeet graduated from our fellowship, he's conducted a variety of research, much of which has been funded by NIH, related to the physiology of yoga and other mind-body practices. Gurjeet completed his undergraduate and medical degrees at the University of Rochester, his internal medicine residency at Jackson Memorial Hospital at the University of Miami in Florida, and is board certified in internal medicine and pediatrics. He also received a master's in public health from the Harvard School of Public Health as part of his fellowship training. Complementing this training, he's completed yoga therapy training and practiced mind-body techniques, including meditation, slow breathing, and martial arts for over 30 years. And he's a very accomplished practitioner of the Brazilian martial art capoeira, which I know he loves greatly. As of this past spring, Gurjeet was selected as the new director of the Osher Center for Integrative Health at Vanderbilt University Medical Center. And in addition to his leadership and research work at Vanderbilt, Gurjeet provides integrative consults and yoga therapy. So without further ado, please join me in virtually welcoming Dr. Gurjeet Birdee.
I'm just going to share my screen. Give me one moment. Peter, thank you very much for that nice introduction. There was one sort of mistake. You said ancillary mentor, and I think I would consider Peter one of my primary mentors back in fellowship and still to this day. So I really appreciate the invitation to share my perspective on this topic of slow breathing from yoga. The practices of slow breathing as it relates to yoga are more than 2,000 years old. And these practices have endured time, and there must be some value. And today we're going to explore sort of clinically and from a research standpoint where this value may lie. I just want to disclose here initially that I am the founder of 2 companies. I will not be discussing any products or services from these companies today. I love the derivative of words, and Sanskrit is a very rich language, and the term for slow breathing practices in Sanskrit, which is the classical language of South Asia, is pranayama. Prana refers to breath in the most physical sense, as we move air in and out of our lungs. However, it also refers to the breath of life, which animates us, brings energy and strength. It is akin to qi, described in mind-body practices and metaphysics from China. And from physical, we quickly see that the term prana extends from the physical to the metaphysical. Ayama comes from the word stretching or expanding, which is where I derived the title of this talk. The practice of slow breathing is in effect stretching breathing over time. There's also a connotation of restraint in the word, but it's better to translate this as control or possessing the power to control the breath. Manipulating the breath is considered a way to manipulate the energy of life, if you will. So from a cultural perspective from South Asia, the practice of slow breathing holds a reverence towards life. So what does slow breathing practice look like in yoga? Here in this graph, I have depicted a slow breathing practice from yoga. The x-axis displays the number of breaths, and with each breath, the y-axis displays the oscillations of each inhale and exhale in seconds. The first few breaths that you see are unregulated, involuntary, and unconscious. Then between 5 and 10 breaths, they become more regulated, and you can see that they are paced, if you will. The inhale is about 4 seconds and the exhale is about 4 seconds. Then you will see as we get to about the 20th breath, you start to see an extension of the breath. and there's an increase in the exhale, progressively to an increase in the inhale. And then you see that there's sort of a plateau that's reached where the inhale and exhale are, the inhale is about 6 seconds and the exhale is about 12 seconds. That is to say that the inhale to exhale ratio is 1 to 2. After breathing this way for a few minutes, the practitioner returns to an inhale and exhale of 4 to 4, which is matched. This is a classic breathing practice in yoga, which is used for stress reduction. And the objective of my talk today is to discuss this practice in more detail. I hope to explain why these techniques are necessary to achieve this breathing practice. Secondly, we will discuss the potential mechanisms of slow breathing, in particular for stress reduction. And lastly, I will share research on the effects of this slow breathing on stress measures. Slow breathing, beyond that from just yoga, is a very common complementary health approach. In fact, after natural products, deep breathing is the most common complementary approach in the United States, with 1 out of 10 adults reporting practices based on data from the National Health Interview Survey. Moreover, deep breathing is part of many other mind-body practices, including yoga, tai chi, qigong, and meditation. So, understanding the clinical applications of slow breathing in isolation or as part of these practices is fundamental to mind-body research. So today, my talk is really focused on slow breathing practices from yoga. However, slow breathing has, as I mentioned, been examined and used in many ways outside of yoga's approach. In general, the research field has defined slow breathing as breathing less than 10 breaths a minute. As mentioned, slow breathing is common to many mind-body practices, and it's used in areas of psychology and performance, such as sports, arts, and competitive activities. In fact, I recall my child coming home from kindergarten explaining to me breathing techniques for relaxation. And yes, a kindergartner that already understands that breathing is related to stress reduction, and it's being taught in our schools today. In terms of looking at the breadth of slow breathing outside of yoga, if we were to categorize them, usually we categorize them as device-guided slow breathing and non-device guided breathing. And so here is a picture of a machine called Respirate, which many of you have heard, which is a biofeedback device that guides people towards slow breathing. Another common biofeedback device for slow breathing is HeartMath. There is substantial research on biofeedback as it relates to slow breathing, and it shows and demonstrates clinical efficacy in various conditions. Non-device guided slow breathing refers to using either something that is not providing biofeedback or is self-guided. And really the most popular medium for this today is YouTube, who I call the most popular yoga teacher in the world. Because every time I ask someone where they learn their yoga or practice yoga, it's always, I watch YouTube. And on YouTube, there are so many self-guided practices for slow yoga. But my goal today is not to compare or review outcomes among these different modalities of slow breathing. In fact, my goal is not to compare slow breathing techniques, because there's not very good data to say that a particular method is better. But there are fundamental differences that I would like to point out between these general categories. So first, device-guided breathing has a focus on a respiratory rate of 6 breaths a minute. There is research and belief that at 6 breaths a minute, there is some kind of resonance with cardiopulmonary physiology and entrainment that produces particular health benefits as it relates to autonomic tone. And this idea of breathing at this rate is considered to be especially beneficial. And so these devices often focus at that respiratory rate. Another feature of device-guided breathing is that device-guided, as it says in its name, you're following an external device to guide the breathing. And in yoga breathing, it's really self-directed. And so what are the features that make slow breathing in yoga different than some of these other techniques? Well, the first thing is that yoga breathing is slower than 6 breaths a minute. There were no clocks, timers, or biofeedback monitors in the forest thousands of years ago when yoga practitioners were practicing. And the rate of slow breathing is meant to be titrated, so it's as slow as possible without the practitioner being short of breath. As it relates to that, the pace of breathing is self-paced. And there are various features or qualities to this practice. One, to self-pace your breathing, you have to pay attention on various factors, which we're going to go into a little bit more detail. And the idea is that people have different capacities in how much they can slow breathe. So among the people on this call, if you were to practice slow breathing, there would be variance in your respiratory rate. Some could achieve lower breathing, some could achieve something that is a little bit faster, but it still may be, at least as it relates into yoga, clinically effective or useful. This is no different than physical exercise, where people would have different physical intensity of exercise, but have good outcomes from exercise. And then the last thing that is distinctive about slow breathing in yoga, and perhaps most interestingly, is that yoga employs different breathing techniques for different purposes. And those purposes can be spiritual, they can be performance, and they can be health related. Today, I'm focusing on breathing practices for health, not the other techniques. And Krishnamacharya, a yoga master from the 20th century, summarizes clinical applications as well. Yoga movements helps the body predominantly, where breathing helps the mind. So I want to describe 4 technical components of slow breathing to give you some sense of the components of slow breathing. And the idea is that you gain an appreciation that this is actually a complex intervention. It's not simply reducing rate. And the components we're going to talk about are the length of breath, how the breathing is performed, how the biomechanics occur, and also what's going on inside the brain. So first of all, the breath length. As I mentioned, yoga practice tries to achieve a breath practice of less than 6 to really be defined as slow breathing. And this occurs through training. And it's very common for people to achieve breaths between 2 to 4 breaths. If I'm working with an individual that's otherwise healthy, it's not difficult to get to 1 breath a minute. And the various techniques used for slow breathing, there are actually specific applications in regards to length, breath ratios, holds after inhale, holds after exhale, even holds in the middle of breath. And while there's so many breathing techniques, there really hasn't been a thorough examination from a research perspective about the clinical efficacy or differentiating the effects of those different techniques. Interestingly, as we look at breath ratios and length of breath, there is a text in a Yoga Sutra textbook. This is the classic source for yoga philosophy that's over 2,000 years old. And in this text, it states that in addition to breathing slowly, that is considered beneficial for one, that if someone extends the exhale relative to inhale, that relaxation is enhanced. And this is really an interesting statement, because extension of exhale is actually used in many of the slow breathing practices outside of yoga, with the idea that it enhances relaxation. Now, as a side tidbit, I did mention that yoga is used for different things among yoga practitioners, health of being only one. But to give you some sense of the mastery of some of the yoga masters, they're really sort of like the Olympians of slow breathing, if you will. This would be an example of a breath ratio that a yoga master would do. So they inhale for 12 seconds. After that inhale, hold for 48 seconds. Exhale for 24 and hold for 12 seconds. This equals about half a breath a minute. I have not achieved this yet, despite doing slow breathing for 30 years. but hopefully someday we'll achieve this. So in addition, and relating to that, it's not all about how slow you can go. There's actually qualities to the breath that are really important, performance qualities, if you will. And the first thing is that the breath needs to be comfortable. If you need to gasp for air, or you push too far, or you feel restricted, then you're breathing too slowly for comfort. And if you think about it, the sense of dyspnea or shortness of breath is actually a really primitive neurochemical neural pathway in our midbrain. And so slow breathing asks the practitioner to lengthen their breath but feel calm and comfort. And it's actually playing with some feedback that's innate inside our neurological system. In addition to being comfortable, the breath needs to be steady. That means it needs to be constant and smooth. I describe it to subjects or students that the breath has to be like a constant note, if you will, like a musical instrument. And so while you're breathing slowly, yoga advises you maintain both these qualities, a comfortable breath and a breath that is smooth. So how do we rate this performance? And so as a teacher, when I'm teaching, I look at someone's breath and can gauge and say, oh, do they look comfortable? Do I think that their breathing is steady? And in fact, I have found, and many people, teachers, use this as a tool that by looking at someone breathe during their yoga practice, you can actually guess how much they've practiced, because you can't fake it. But in terms of a more validated measure, we did develop a scale for individuals to rate themselves as part of a yoga self-efficacy scale. And this, in one of the domains of yoga self-efficacy scale, where we rate people's ability to be confident about their yoga skills, we focused on breath. And you can see that many of the items on the scale pertain to the qualities of breathing comfortably and steady. So next I want to move you, we talked about the length, we talked about the performance, but now I actually want to talk about some of the mechanics. And so when we're all breathing here quietly, most people are familiar with the breathing mechanics, but I'll go over it quickly. Inspiration is largely driven by the diaphragm, which is like a dome muscle underneath the thoracic cavity. And as it contracts, it pushes down on the abdomen, creating more space in the thoracic cavity, and negative pressure then allows air to flow into the lungs. In addition, muscles contract in the ribs that allow some expansion in the intercostal muscles, the muscles between the ribs, to expand and allowing more inspiration. During expiration, these muscles relax and it reverses the process, which is a passive process at this point, not active contraction, because the muscles are relaxing and air comes out. So this is how breathing occurs normally when all of you are just sitting here listening to this lecture. The process of breathing in yoga is different because it's not involuntary, it's voluntary and it's forced. And so first, in the inhale, the diaphragm is still involved. However, there's much more active use of the chest walls in yoga for breathing. Secondly, on exhale, there is use of the abdominal muscles, and in particularly the transverse abdominis muscle. So here, the picture on the left is showing a contraction of the transverse abdominis. It's as if you're drawing your belly inward or sucking your gut in, and you can see that the abdomen goes inward. And the picture on the right shows sort of someone bellowing their chest, which is really that expansion of the chest. And yoga uses these muscles more actively to increase the depth of the breath. Now, I'm going to admit to you that, when we think about slow breathing, the common term that's used is called diaphragmatic breathing. And it's true that the diaphragm is still very involved in this description of breathing that I'm describing you. However, if you want to lower your breath rate in a comfortable way, you actually have to actively engage these additional muscles, because diaphragmatic breathing, while it can get you there, it's actually much more efficient from a yoga perspective to engage these muscles, which is on exhale, the transverse abdominis, and on the inhale, the chest wall muscles. The other technical component that I'm going to go over is what's called ujjayi, which is a slight glottal restriction that happens in the larynx and around the glottis. It's a narrowing in this area with slight engagement of the vocal cords, and that reduces airflow during the inhale and exhale through the upper airway. The function of this is that it allows for more control of the breath. It also creates a tangible quality of the breath, which allows the practitioner to gauge if the breath is smooth and steady. So in total, these techniques, really, particularly the biomechanics, allow for maximal movement of the air in and out of the lungs in a regulated way that is comfortable and steady. Now, needless to say, performing breathing at slow rates with the correct biomechanics and using the glottal restriction, and while being comfortable and creating that steady breath, takes a lot of attention. And the attention component is fundamental to slow breathing in yoga, and so it's a key component to it. One has to continuously monitor the performance and function, and though you can get habituated, what happens is the capacity to pay attention actually varies from day to day, and yoga practitioners often use their ability to breathe slowly with these qualities as a barometer of their ability to focus. It is a test to see if they are sufficiently prepared for meditation. And I think that this is a really important point from the perspective of yoga, is that slow breathing classically was used as a preparation for meditation. And this is a generic sequence of slow breathing in yoga that might be used, that you observe your breathing and then you start to regulate your breathing. And there's a sequence of how you regulate your breathing. Some of this is not done the same day, but over time, and then you meditate. So that being said, I would like to take us through an experiential of these techniques. So I know many of you have probably done slow breathing before, but I just want to engage some of the techniques that we talked about. And so usually we would teach these techniques over weeks progressively, so people feel confident and it's progressive. So, or I should say comfortable. But today I'm going to do it in 2 minutes. So with that being said, if you are sitting, I would ask that you sit on the edge of your chair and you sit in an upright position. You can close your eyes if that's comfortable. And as you close your eyes, place both hands on your lower abdomen. And as you place your hands on your lower abdomen, just be aware as you breathe naturally here, the movement, if there is any, as you breathe in and out. So as you breathe in, the belly might expand. And as you breathe out, the belly might move inward. It may be different for different people. So if there's little movement or the movement's different, no worries. We're just in the observation phase. Now, take 2 hands, your 2 hands, and place them on your upper chest. Same thing, you can keep your eyes closed if that's comfortable, just so your attention goes towards your breath. And just observe your breath and see if there's any chest wall movement. Inhale, your chest might move out or expand. And then as you exhale, you might notice that it moves inward. Now keep one hand on your upper chest and one hand on your lower belly. As you exhale, I want you to make the sound, a gentle sound, like you're trying to fog a window, like inhale, preferably through your nose if it's not stuffy today. Exhale, making that gentle sound. And as you exhale, gently making that sound, I want you to focus on your lower belly and draw it inward towards your spine gradually as you exhale. So if your hand's on your lower belly, exhale, make the sound, and your belly goes inward. You may notice that if you draw your belly inward more, you exhale more, and you may exhale more slowly. So having done that, keep breathing like that on your exhale, but now bring your attention to your other hand on your upper chest. And as you inhale, expand your chest. So really try to move that chest wall, expanding it as if you were feeling it underneath your hands. And then on exhale, use your abdomen to draw your abdomen inward, and your chest wall will fall naturally. So the starting position is the belly is inward. At the end of exhale, you inhale into your chest, expanding your chest. You'll notice that your chest fills, then your belly naturally fills. Then at the top of it, you exhale, draw your belly inward, and your chest falls. You can disengage from that and just keep your hands on your chest and belly and take a few natural breaths. And then just open your eyes if your eyes are closed as we continue the lecture. So I want to be clear that the idea of showing you that wasn't to give you an experience of relaxation. It was an idea to give you some experience of some of the techniques that are used in yoga. And, you know, if you couldn't do it, I wouldn't be surprised. If you could do it, you're a natural. Either way, I just want you to understand that it's a complex biomechanical attentive experience of slow breathing. And so that being said, you know, usually slow breathing is taught by an instructor in yoga, a teacher. And so we do have to understand that outside of the techniques that are used for slow breathing, there are other potential benefits in this intervention, which could be the therapeutic relationship of the teacher. There are many people who, as soon as the teacher starts talking, they start to relax. And then the expectations around the possible effect of slow breathing. And since slow breathing is so commonly associated with relaxation in our culture, it'd be hard to isolate that relationship from someone who's learning to do it. So we're going to move more towards the research and science, having described the techniques of slow breathing. And one of the questions is, why is breathing a potential health intervention? And one of the reasons why breathing is it's so intertwined with multiple organ systems. It has various inputs and outputs within the brain, within the heart, within the lungs. And it's at this very interesting juncture in our system between unconscious and conscious control. And it's exquisitely calibrated. If we get up and walk down the hallway, our breathing automatically adjusts. When we go to sleep, our breathing is nice and smooth. And this beautiful picture is from a recent review article in March 2022 by Dr. Feldman and his colleagues from UCLA, which really describes the most recent understandings on breath rhythm and the diverse and complex inputs and outputs of breathing. And the advances in neuroscience, largely relying on animal models, shows this spectacular complex mechanism of how breathing is being regulated. And my goal of showing you this slide is really to show you, if you look at the input of all the various things that affect breathing, there's so many things, including emotions and cognition, that our breathing is responsive to. And then in the same way, these same things are affected with output. And when we look at, well, what's going on with slow breathing and how are these inputs actually being detected by our system and brain, we know that the nervous system is sensitive and has sensors throughout the respiratory system, including the ability to detect changes in pressure inside our chest cavity, including stimulation of arterial and cardiopulmonary baroreceptors, which is perhaps one of the more fundamental mechanisms as it relates to the heart. There are stretch detectors inside the lungs, inside the pulmonary, in the actual lung system, that as we breathe in and out, that are sending data to our brain, if you will, with each inhale and exhale. And then there is also this idea that the frequency that we breathe might actually resonate with our heart, which is this idea of entrainment that I mentioned before, cardiopulmonary oscillations, and in particular a focus on 6 breaths a minute, which is the basis of biofeedback machines. But the idea is that this slow breathing is intertwined with our system. You know, I have a more simple description of what happens that is really on a superficial level, but how we describe it in yoga. And, you know, since breathing can be voluntarily controlled, it provides a way to influence and hack some of these major complex neural pathways, including emotion and cognition. So, you know, when we have an agitated, unfocused mind, our breathing is short and it's irregular. You know, the principle of yoga is that, you know, this is a bidirectional pathway. And so when we breathe regularly and slowly, you know, we link this to our physiological and psychological states of relaxation. And when practiced regularly, the body associates this state with relaxation, and we start to shift it more and more over time to a relaxed state. And perhaps even if it's just temporarily through a practice, invoke it. And, you know, this is really the predominant theory of how breathing practices work. And many on the call are familiar with this, that, you know, stress is one of the main mechanisms of how we think mind-body practices work. And there's no doubt that mind-body practices produce an acute relaxation for physiological and psychological relaxation. There is some question, though, in terms of long-term changes. And so I'm going to go a little bit over, you know, I'm looking at the time. So as I mentioned, you know, stress reduction is the most common mechanism for how we think slow breathing works. And there's been substantial clinical applications of slow breathing and research in various areas. And so the one that we see the most research on is anxiety and depression. There's also been research in chronic pain, acute pain, lung conditions, diabetes, obesity, and also cardiovascular health, with most of the research looking at hypertension. And you know, I really am emphasizing here that the research is focused on stress-related condition because that's the predominant mechanism proposed. I do want to share with you some questions of research that we asked as it relates to that. And because there are some limitations in the research that have been done before. and particularly looking at if slow breathing causes chronic long-term changes in relaxation. And so we ask these some fundamental questions as it relates to yoga breathing. Does slow breathing reduce psychological and physiological relaxation? And then the second question we asked is, can you dose relaxation? In other words, can you test this hypothesis based on Yoga Sutras that if you extend the exhale relative to inhale, does it increase the effects of relaxation? So in a study funded by NIH, we examined these two questions in a clinical trial. We took 100 healthy adults, so no stress problems, and we randomized them to 2 slow breathing interventions. One intervention had exhale equals inhale, and another one is an exhale greater than inhale. These were all taught in person by a yoga therapist. We asked them to practice every day, and we measured stress at baseline and at 12 weeks. Now, I would want to say that we did not have a comparison group of someone not breathing or an observational control or anything like that. The study, because we were really looking to see what the effect is of ratios and what happened with stress in both groups. And for psychological stress, we used the standard measure of PROMIS anxiety. As you know, this is a measure that's been created and it was funded by NIH to create, where the mean score in the population is 50. So that's considered normal with a standard deviation of 10. If it's higher than 62, you have an anxiety disorder. And then for physiological stress, we used spectral analysis of heart rate variability. And our primary outcome was looking at vagal tone, which is representative of relaxation, parasympathetic tone. And we did both these measurements at baseline, 6 weeks and 12 weeks. And so this is our study protocol of slow breathing of these 2 groups. And so you can see initially there's a 2-week phase where we make sure that they can adhere to slow breathing, that they can actually achieve some slow breathing. They're randomized at baseline, and then they go into these 2 groups of where you breathe slowly, exhale equals inhale, or you breathe slowly, but your exhale is greater than inhale. The one thing I want to highlight is that everybody has a progressive practice, which is consistent with yoga. In other words, they were titrated with the teacher to breathe as slowly as possible, but still be comfortable. And because it's randomized, the respiratory rate, while there's variability within the group, it's balanced between groups because of randomization. And so we screened people, and we succeeded in getting mostly healthy people. By the way, all participants were blinded on the purpose of the slow breathing. So we didn't recruit to say that it was causing relaxation, and the teacher didn't use the word relaxation. We just really focused on the technique. In the end, we ended up with complete data on 97 subjects, as you can see, and we had excellent outcome assessments. And the other great thing about this data is that people really practice the slow breathing. They practice on average of 5 times a week. So we really got a great exposure to both, in both groups, to the intervention. One of the things we used was biometric shirts to measure the fidelity of slow breathing. So there are these smart shirts that have EKGs and bands that measure inspiration and expiration, and we gave them to participants to practice at home so we could see in real time if they were achieving slow breathing. And so this is just a picture showing some data from one of those vests, and you can see that this participant was breathing, which is the light purple line at the bottom, between somewhere less than around 4 breaths a minute, between 2 to 4 breaths a minute for most of the practice. And using these biometric shirts, we could actually measure the fidelity of the breath ratio. In other words, we could look to see if the inspiration and expiration that we prescribed and that the yoga teacher was observing when they were teaching them, there was the same fidelity. So here, the ratio in the top right corner, you can see a majority of subjects who were prescribed equal inhale to exhale are in the top right corner. And in the bottom left corner are those with a differential or extended exhale. And so you can see from 4 to 6 weeks, while there's a few people here in the inhale exhale group on the far right margin that weren't breathing as equal, that for the most part, we achieved high fidelity. So we feel confident that people actually did the breath ratios and the breathing practice, and the exposure was good. And so that being said, these graphs show the measurements for psychological and physiological stress at baseline in 12 weeks. And for the graph on the left, the y-axis represents the PROMIS anxiety, which is our study population. It had a baseline stress level of 56, which is a little bit higher than the general population. But by 12 weeks, you see a decline in anxiety of about 5 that is statistically significant. On the right, the graph plotting the high frequency heart rate variability, there's a small increase, but it's not significant. So heart rate variability is really a measure. The high frequency heart rate variability is a surrogate measure of vagal tone. And so this suggests we saw psychological relaxation, but not physiological relaxation as measured by cardiac parasympathetic tone. This graph shows PROMIS anxiety measures among the 2 breathing interventions, with blue being inhale equaling exhale and red equaling extended exhale. And you can see that both had a change in reduced anxiety, but we see that one did have a further decrease in exhale. These differences, however, were not statistically significant. We performed a regression model, looking at baseline anxiety to see that if you had higher baseline anxiety, what happened as people responded to therapies. And the colors are actually switched from the prior graph. Here, the extended exhale is blue. And what you see is that the higher anxiety levels, you do see a further decrease in anxiety if you had higher anxiety at baseline. And it does look like there's a little bit of a difference over among people with higher anxiety between exhale greater than inhale. In other words, it may be that that among people who are more anxious, we see that extended exhale has a more dramatic effect. However, since we recruited healthy subjects, we didn't really have enough power to measure this. I want to highlight that we did see positive effects in other measures of mood, including depression and the PANASEX, which is a generalized measure of negative affect. So this leads to this question. We saw this improvement in psychological stress, if you will, not so much in physiological stress, but perhaps there's a correlation among psychological stress and physiological stress. And so these correlation scatter plots show PROMIS anxiety on the y-axis and high frequency heart rate variability on the x-axis. The top 2 graphs show at baseline in 12 weeks cross-sectional data with psychological stress and physiological stress at that specific time. And then the bottom scatter plot is showing over time changes in psychological stress and heart rate variability from baseline to 12 weeks. And really, in all of these time points and over time, we do not find a significant correlation between these measures. And so really, in terms of the summary of our results, we saw slow breathing, decreased psychological stress, and there may be a difference between breath ratios with those with higher anxiety, but we didn't have enough power to see that. And we didn't really see any significant effects in psychological stress as measured by heart rate variability. We also did full autonomic testing, and we have yet to find any significant changes in those measures, except perhaps baroreflex sensitivity, which has been shown in other research as well. And lastly, no correlation between measures. Now, I want to switch to another outcome that has been so common when we looked at clinical applications of slow breathing, and it's blood pressure. Now, hypertension is a complex condition. It really isn't caused by one thing. It's multifactorial. But one of the things that's seen in many patients with early hypertension is increased sympathetic tone and decreased parasympathetic tone. Another note in terms of is that psychological stress does not correlate well with essential hypertension as an outcome or an association. So, we did some more examination looking at effects of blood pressure and slow breathing. And what you can see is that on the left side, that the slow breathing reduced blood pressure at baseline to 12 weeks. We used a comparison group, not from the same data, just to show habituation from the lab. And you really see that over time, people with normal blood pressure, you wouldn't expect any changes, but in our group we did. And we also dichotomized the data with people to see if people with elevated blood pressure, of course, had a further decrease. And this is what that graph shows, that if your baseline blood pressure is higher, we see a further decrease in systolic blood pressure. Of note, the blood pressure that we notice among people with higher blood pressure is about -10 systolic, which is just as good as most drugs for blood pressure. And so this data is consistent with other data looking at the effects of slow breathing and blood pressure. And so this is a meta-analysis of the effects of slow breathing on blood pressure, with the top section here, this forest plot, using device-guided slow breathing, suggesting that there is a clinical benefit to slow breathing. And also this bottom section is a forest plot for slow breathing. So cumulatively, it looks like slow breathing does produce low blood pressure. Interestingly, we did look to see, is there any correlation between this reduction in blood pressure and anxiety, or is there any correlation between slow breathing and autonomic tone? And we really didn't see any correlation in those changes. And so we think that the changes in blood pressure are going to be are not related to psychological stress. And secondly, at least in terms of mechanism, probably not related to heart rate variability. So I want to sort of summarize some of the things we talked about today. Is that, yoga breathing is pretty specific in its technique. And I will admit to you that, the intervention that we studied is not, if you look at most of the slow breathing techniques that have been looked at, a lot of them focus on a respiratory rate of 6. Ours is slower. And the second, a lot of them have focused on diaphragmatic breathing and not the exact same techniques that we did, which may be why we achieved slower breathing. But we did achieve very high adherence in our study. And we clearly see some changes in psychological stress and blood pressure, but no associations, as I said, with autonomic tone. It's very interesting, though, in terms of autonomic tone, though, because most of the biofeedback devices are, in principle, focusing on that as the primary mechanism of how slow breathing is working. So where we are going, we're really interested in taking this information and data and looking at populations with more stress, if you will. So we looked at a normal, healthy population. The question is, if we took the same intervention and exposed people with higher stress, what happens? And of course, we'd want to include comparison groups that adequately match the intervention, because we didn't have that. Ultimately, there does need to be some comparison on types of breathing techniques, because the techniques that I described have been studied less. But at the same time, we can titrate and probably try to match some other types of breathing techniques. And lastly, we're really interested in exploring mechanisms beyond autonomic tone. I think we're end our time, and I see Peter is very close. Yes, Peter.
Yeah, we should wrap this up just so there's time for a few questions.
Sure, I agree.
So yeah.
Thank you.
So that's fantastic, Gurjeet. Thank you for such a rich talk. And it's so clear that, going back to some of the diagrams that you showed, how rich a portal breathing is, and I love your phrase, to hack multiple physiological systems. It's so complex. It includes so many variables in terms of pacing, quality, posture, attention, that it is this fantastic tool that I think creates a lot of opportunity and challenges for trying to bring reductionistic medicine to this very complex systems holistic approach. And so a lot of the questions are around that. I'm going to lob you one that goes right into the depth of physiology. And if you can keep your responses to like 30 to 60 seconds, I can get one or two in, and then I can do some outros. But this is a question from an autonomic physiologist here that you probably know, who's done a lot of work in breathing in her autonomic lab, Vera Novak, and her husband, Peter Novak, colleagues of the Osher Center. But she wrote, breath holding is associated with hypercapnia, which increases cerebral perfusion. Are you aware of any studies using TCD or MRI to measure the effects of yoga breathing on cerebral perfusion, both short-term and long-term effects? And then there's an ancillary question about not just hypercapnia, but effects on nitric oxide from another person. So good luck.
Yeah, no, those are excellent questions. And, actually, I don't know if that, Vera, if that's specifically been studied. And, I think one of the, and we definitely could do a literature search looking. I think one of the challenges is if it's been done, what breathing techniques have been looked at. But, the neuroscience research is really growing in this field. And so we could probably find that answer, but I don't know off the top of my head if that's the case. The other thing I would note, though, you mentioned hypercapnia. And actually, what's interesting that happens in people who are trained with slow breathing, that the CO2 is actually, you don't become hypercapnic. Actually, your CO2 can actually be normal during slow breathing with training, despite it being slowed. So that's one important point.
Yeah, again, the differences between short-term effects and longer-term effects, and then even the effects of these masters that, defy.
Yeah, and we don't know. Excellent question.
Yeah, one, again, going into how everything is intertwined, another person, Peter Stein, asked, is increasing the proficiency, at breathing slower also related to, not confounding, but does it also influence the volume of the breath and or the metabolic oxygen requirements, which I think you were just getting at with the hypercapnia thing. So again, how changing one parameter could really touch upon in a systems way all these other factors.
Yeah, so the research shows, and I actually brought up a slide for this with Birdee, who did this now 2 decades ago, that slow breathing, and he was using mostly diaphragmatic breathing, looks to be more efficient in terms of physiology, in terms of it actually increases oxygenation, and despite he put people in a hypobaric chamber. So, the idea, is it more efficient? There is thoughts that under stressful situations at rest, at least like high altitude simulation, that it is more efficient. So that would be my response to that. But I think a lot of it depends on, what you're doing. Clearly, if you're doing slow breathing and you're running, it's not the most efficient respiratory mechanism.
Super. Well, there's so many other questions. I may forward these questions to you, and if you had some spare time, maybe you can respond to some of these questions in a virtual space.
Sure.
I didn't manage the time well enough to cut you off, but it was so fascinating. I wanted to let you just finish your presentation. There's a couple comments here on the use of HRV analysis, and there's some suggestions of different ways of looking at your heart rate variability data.
Yeah, I would love that. I'm looking at Satvir's recommendation. We did use paced breathing at a fixed frequency in our HRV evaluations. I sort of alluded to that. In our autonomic testing, we sort of go through the battery of autonomic measurements, And we still didn't really find any significant differences.
And as
So
you
thank
know,
you.
yeah, Andrew On, who's presented here, and Jan Ma and others have been looking at all sorts of novel ways, and there may be some interesting other data hidden in your rich database that I'm sure they'd love to get their hands on. So
I would love to share that.
Yeah, thank you for what I knew was going to be a really informative talk of someone who really not only has depths of knowledge as a scientist and an appreciation of the clinical applications of this breathing, but also just as a practitioner and all the nuances here that many people don't appreciate. So thank you for that. I'm going to just verbally remind people of a couple important things coming down the pipeline at Osher. Once again, please be on the lookout for our network forum. Come to our website for that. We also want to encourage you to apply for the T32 fellowship, if that's an appropriate mechanism for you. The due date for that is the 3rd. And I want to also alert you to a couple of important grand rounds coming up, and there's 3 really exciting ones. The next one, coincidentally, is another graduate of our program, Paula Gardner, and it's a fantastic talk called "The Doctor Will Meditate with You Now: Implementations of Mind-Body Practices in Clinical Care." And you'll see there'll be some nice extension and overlap with what Gurjeet was presenting. The one in November, on November 1st, is going to be Dr. Maren Nair, and she's going to be talking about whole body hyperthermia and depression. And then in December, we have a special Kogan lecture with David Rakel. Many of you in the integrative medicine community know him. He's written many textbooks on integrative medicine. He's also a director of an Osher Center, and his title is called "Doing More and Talking Less: Doing More, Talking Less, and Living Longer. Health is more about what you do than what you take." So with that, I want to just thank Gurjeet one more time for such a great presentation and taking time to present this. And I want to thank all of you for joining us here today. You can look at the archived prior grand rounds on our website. This one will also be posted in a few days. There's lots of other information you can find there, and you can even make a philanthropic donation to support our Osher Center at osher.org. So thanks again, and I wish you the best in our new fall season.